And it's really interesting because he makes the statement in there that it's full on competition now, that they have matured, that their technology in some cases is better. It gives a better experience all around for banking or lending than even JP Morgan with their size and scale can give. And when I was reading some of these things, I thought, that's an interesting perspective. CEO JP Morgan saying, look, they're not nipping at our heels anymore. They're actually stepping into our backyards and they are actually making an impact. Do you think we're going to start, or are we already starting to see that in healthcare? Or do you think that dynamic is going to play out in healthcare?
I hope it does. I got into healthcare because I saw inefficiencies and things that could be so much better for patients. And well, I don't know if we've had this conversation before, but I tend to, and I'm not saying this to brag because it's actually not a brag. I tend to see things like, 10 to 15 years before they happen. And I go, this is going to happen. And I get all excited. And then it's like, well, yeah, but wait. Yes, it will happen, but wait. And that's how, with healthcare, it will happen, but I still think it's going to be a while. And then to me, like, the infrastructure costs are so high and the tech stays around so long. So if you think of the infrastructure to build a hospital and how long you have all of the tech that's in that hospital, and think about, I was reading an article again yesterday about IoT, and I was thinking so much about all those devices in hospitals that are either connected or disconnected and potentially security risks, and things stick around so long that I think it's going to be a while. It's still going to be a while. And, we were also seeing hospitals, they've been on this innovation bandwagon, and we can talk about innovation as, some people talk about innovation theater and it's just to try and look innovative. But I think that the first wave of innovation was, oh my gosh, there's all this stuff happening with the initial digital health. And it was innovation theater. And now, though, they were questioning the ROI of that and actually looking at how do we do different things? How do we partner with different types of organizations? So the pressure's there, the change is coming, and I think we'll end up in more of a hybrid. That's my prediction, but it's going to be a long time.
Yeah.
I was just reading, there was I didn't give you this one, but there was a Forbes article on Epic yesterday that I was reading, and it was just reminding me just how big they are and how many hospitals they run and how that's not going anywhere quickly.
No, it's not going anywhere quickly. And that's one of the things that sort of, having been in the CIO chair and having looked at it, the amount of money we spend on the EHR and the maintenance of the EHR and the time we spend on the EHR is huge. And now a lot of people would be listening to this and saying, well, of course it is, Bill. It's the most important system we have. It runs so much of the hospital. I'm like, yeah, but no other industry does that. No other industry spends that portion of their IT budget and their staffing and their time on maintaining a system like that. It's almost serving the system rather than really focused on, what it can do for the community or the patient or the efficiency.